I'm Vere Lancaster, the Medical Director of Intermountain Homecare, and one of the questions that we've had recently was on what the letters DVT stands for. It is DVT Awareness Month, so let's talk a little bit about that as an informational item. DVT stands for Deep Venous Thrombosis, and it is a blood clot that forms in the veins of your legs. And it is more common than is realized. The symptoms are sometimes very subtle and very hard to detect. You can have pain in the calf, which is the most common symptom, a sudden pain in the calf. If it gets worse, you can have ankle swelling and even sometimes redness around the area of the pain in the calf. But sometimes only one of those three symptoms are present. And that brings us to what are the predisposing conditions to deep venous thrombosis. So one of the common things about deep venous thrombosis that predisposes you is long airplane flights, long bus rides, long periods of inactivity with dangling feet, recent surgeries on your lower extremities, and especially recent surgeries on your knees, like orthoscopic surgeries on your knees or abdominal, intra-abdominal operations. So if you have done any of those things in the last 2 to 4 weeks and you start to have pains in your legs and achiness in your legs, then you should go for an evaluation with your physician. The most common way of finding out whether you have deep venous thrombosis when you get to your physician is they do an exam, see if your calf is tender to touch, if it's hot to touch, or if there's swelling. But often the best way is they'll send you over for an ultrasound at the hospital, where the ultrasound technologist will put a sound wave probe on your calf muscle and see if there's clots in those leg veins. If there is, you do need to be treated. It is very important that if you have any of the instances or predisposing conditions that I mentioned to you, and you have pain in your legs, swelling or redness, or especially if you feel suddenly short of breath or have chest pain, to contact your physician and have an evaluation for deep venous thrombosis. It is a very commonly missed condition. Thank you.